5, we gave 5 extra minutes, and I'm sure people are still going to keep trickling in. If you haven't already grabbed food, you are more than welcome to do so right now.
So, again, welcome everyone, whoever is in person here and online. My name is Mir.
And my name is Angel.
So we're the organizers of this cafe. So thank you so much for investing your time with us today on this Monday. Just before we begin, let us acknowledge that the Tech Center is part of the city of Kingston, which is situated on the traditional homeland of the Anishinaabe, Haudenosaunee, and the Huron-Wendat. We are grateful to be able to live, learn, and play on these lands. Just a few housekeeping points before we begin. Food and drinks are on the side, as you guys are saying. You are welcome to sit or stand at the cocktail tables in the back. Washrooms are down the hall to the door. And just a quick post-event thing, because some of you may have to leave because your lunch times are going to be over. So a post-event evaluation form will be emailed to everyone at the end of the event. We would really appreciate it if everyone can fill that out and through the email, through the link that they'll be getting through the email. We printed out a few copies for anyone who would want to complete it in person before they leave today. So today we have an amazing panel on use of smartphone data in public health research. Smartphones have become an essential part of our daily lives, and the proportion of smartphone users is rapidly increasing. Unbeknownst to most users, the apps that are being downloaded on their phones are given access to track and record user locations for advertising and marketing purposes. Recently, cell phone GPS data has incurred interest as a tool for the government and researchers to inform public health measures. While this is exciting for the research world, there are evident concerns from the public regarding data privacy and ethical boundaries. We hope that today's event will address both sides of the conversation and raise awareness about the collection of smartphone GPS data and its potential uses for research.
So the agenda for today involves 3 presentations from our 3 panelists. Each are going to be talking about the experience that they had in this field, and then we're going to open the floor up for questions and discussions. For the discussions, we actually create an online poll for those who prefer to type their questions in, and this is accessible through this link and this QR code displayed. You're welcome to open it up now so that you can type in your questions as the presentations go on, or we're going to pull this up again at the end of the presentation so you can access it then as well. If you're still welcome to voice your questions as well. If you feel comfortable, we'll walk around with the mic later. And this applies for both in-person and Zoom attendees. You're welcome to use this link. The discussion portion will be led by Dr. Samantha Buttermere, Sam, wave, who is the Associate Program Director of Public Health and Preventive Medicine Program at Queen's University. We have a stellar lineup of panelists with us today. Our first panelist is Christopher Allison, who is the Director General and Chief Data Officer of Data Management, Innovation, and Analysis at the Public Health Agency of Canada. During the COVID-19 pandemic, one of Chris's teams used mobility data to study population movement patterns to evaluate how well public health measures were being followed. Our next panelist is Dr. Sahar Saeed from Queen's University, whose research focuses on mobility data and on how mobility data can be used for public health decision-making. She's currently leading projects on the scope and considerations of using mobility data for epidemiologists. And our third panelist is Dr. Martin French from Concordia University, whose research interest examines the broader social and political context of communications and information technology, focusing especially on risk, surveillance, privacy, and social justice. Now, without further ado, please give a warm welcome to Christopher for our first talk of the day.
So I'm Chris Allison. Again, I'm the Chief Data Officer for the Public Health Agency. And as per the intro, so we were using mobility data when I came into the agency in mid-2021, so kind of in the middle of the pandemic. We're going to do kind of a quick run through here, but really looking forward to the questions. So I'm going to start off with kind of the framing for any use of data in the government of Canada. And most of this focuses on the privacy legislation that we have in place. So we have the Privacy Act, which governs public institutions, so the government of Canada. And then we have PIPEDA, which governs private institutions. And they both intersect, and they both actually relate to how we thought about and how we use mobility data in the government of Canada. Because, of course, we were not getting data directly from citizens. We were getting it through third parties who TELUS and Blue Dot, who were responsible under PIPEDA. We're going to kind of go along. So the story, right? So basically, we had the start of a global pandemic that nobody was expecting would happen, and that we were not really prepared for. We didn't understand what was going on. We didn't understand exactly what COVID was, how it worked, how it propagated at the start. Like, everyone remember, like, wash your hands and everything will be fine. It turns out we learned a lot throughout the pandemic. But at the start, the Public Health Agency basically put out a call to other organizations to said, we need help here. Who has data that might be useful to help us to understand what's going on? So 2 departments basically responded back, both under kind of ISED. The Innovation, Science, and Economic Development is the government organization. And they both kind of put us in touch with 2 different types of mobility data that were based off cellular devices. Sorry, I'm getting a bit of feedback, see if this is any better. So based off these, so basically one was working with TELUS and their Data for Good program. The second was working with Blue Dot, which was a public health focused data business that's being run out of Canada. So we did a lot of stuff to kind of say, okay, like, how can we use this? Great, we've got some opportunities. How do we actually take it, and how can it help us to figure out what's going on in the pandemic, to generate better public health guidance, and to really kind of serve the mandate of the agency, which is to protect and promote the health of people in Canada. So that's kind of the focus here. So one of the first things that came up was just like, what is this data, right? It was fairly new to the agency itself at this point in time. And so starting to working with, the communications and radio, I'll find the acronym at some other point, but basically the broadcasting folks who were starting to experiment with this data, we needed to bring it in and sit down with public health professionals and epidemiologists and start to say, what is this? How do we use it, and how do we make it useful? Part of this was actually doing a whole bunch of homework on the ethics of how this could happen. So we have an expert advisory panel made up of external folks. So we ran it past them. We engaged with the privacy commissioner. We engaged with experts on privacy and data within the agency. And there's a whole bunch of stuff that came out of this. One, the Privacy Act is triggered when you're talking about personal information. The data sources that we were looking at did not contain personal information. Despite this, the team went through a long series of kind of checks and balances to make sure, well, even then, how do we make sure that as we're doing this, we're doing it ethically? We're restricting access and use to only the people that need it. We're making sure that we are accessing it in appropriate ways. And you've got, so Blue Dot, or sorry, TELUS we'll start with, they received a pretty major, I think it was like an international award for data privacy. And the way that worked was, in order to access their data, you basically would submit, this is the query we would like to run. They would look at it, they would vet it through their internal panel on ethics and privacy. They would say, this is in, this is out, this is what we can do. And then once that had been agreed, they would kind of send it out. Blue Dot did similar things. They basically went through and they redacted and kind of pulled, we never had access to line level data. We got reports based off aggregates of that. And I'm going to show you exactly what that looks like. And then there's the requirement to opt out. And I'm going to talk about this a lot more. Informed consent. Do I know, as a person in Canada, how my data is being used? And have I agreed that it would be used that way? There's always been the intent, even in the Privacy Act, that there is a tension between public good and the rights to privacy. It's not a universal right. If my privacy means somebody else is going to, suffer grievous bodily harm, my privacy might not be the thing that wins out in that discussion, nor should it be. But going through all this is part of like the learning and the growth and part of what the exciting discussion we're going to have today. So these are the two types of mobility data. So again, crowdsourced or app-based. This is the stuff where, you or someone is playing Candy Crush, right? And at the start you said, do you agree that this, you sign onto the user agreement, and part of that is, it's going to use your location data. Why does Candy Crush need that? Don't know, but sure. Why not? So the reason Candy Crush needs it is because it's free and they sell that data and they make money off selling that data. So that's crowdsourced data. It is highly accurate, or at least the stuff we had. So it was very pinpointed. Again, we never saw any personal information, no individual, but it was highly accurate. But it was very, very, it was small percentages of people. It was hard to tell what those folks would be like. It was hard to actually understand exactly what was going on through the data. We actually much preferred the second, which was the mobile operator data from TELUS. It had limitations as well. So again, all of this is aggregate, no line level data, no Chris Allison is in this place at this time. And I'll show you exactly what it looks like on the next slide. But even then there are limitations. TELUS has about 30% of the market for cell coverage across Canada, but it's not evenly spread. Some provinces are more, some provinces are less. Also, this looks at devices, not people. So if somebody's walking around with 3 devices, other people are walking around with none, like the data is not going to be perfect or clean. So the question is, how do you use the data to derive some valuable insights, right? To understand what's happening with the world. So I talked again about like the fact that this is not personal information. So one of the things, and so there was, folks here probably know about it, there's an article written in the BlackRock Reporter that said the Public Health Agency confesses to secretly tracking 33 million Canadians through their cell phones. That was not true. This is what the data actually looked like, right? So basically we had a couple of different types. One was time and distance away from primary location. And what this means is I wake up in the morning, my cell phone has been charging all night. During the day, does it stay within like a distance, 10 meters, 25 meters from its primary location throughout the next 24-hour period? Or for what percentage of the time does it do that? And we were using this as a proxy for understanding mobility and movement of people during the pandemic, especially in a time when we had lockdown orders, right? When people were asked to stay home, how many people were actually staying home? And this is kind of what it looked like. So effectively, we had it aggregated to a healthcare region, equivalent to the size of about a municipality, like normal municipality. We had it aggregated to a minimum of like 20 devices within that area. We had it aggregated to a 24-hour time period. And then we had it kind of all pulled together into, again, no personal data at all. So the important stuff is like, what's the location, what's the time? And then you've got different percentages of like maximum distance away. So of however many people are in that region, if you look at the first kind of Huron-Perth Public Health Unit, I'm gonna walk in front. Here, this is saying like 3% max distance, right? So, and then the number of devices, you can see kind of the aggregate there. Another type of data we used were device visits to public locations, which again, you can say a national park, Bois Papineau, how many visits over the course of a day. So again, there's no personal information in this. There's nothing that points to Chris Allison did this or any person did this. What we know is, how many people went to this park? How many people went to this hospital, right? And then through that, we can understand, okay, where are people congregating? Are there outbreaks in these areas? Is there something important that we need to know from a public health perspective? I'm easy. What do folks want? Okay, sounds good, sounds good. Right, and then there was one third type of data, and that was basically transit between different cities, right? Again, same thing, 58 people went between Montreal and Ottawa within this 24-hour period. Again, no kind of other data. So this is what we had. So again, all of this was de-identified, massively aggregated, and we just looked at a couple of the things that, like, what we thought would matter in understanding the movement of people, right? People, large groups of people throughout the pandemic. One important thing is we are not currently procuring or using mobility data, right? And we'll get to some of the whys about that in just a little bit as well. So what we learned a whole bunch of stuff. So one, we could actually look at, okay, like across these data sources and pulling them together, what was the, respect for different public health orders that went out? How many people were staying home? How many people were kind of going out? And we could see both how it kind of moved throughout the pandemic, which is kind of what you're seeing here, but we could also see fatigue, right? Like we could see that, the second time there was kind of that, Delta wave or Omicron, folks were asked, like, it didn't stick the way it did. So that gets into other parts of public health, which is human behavior, right? Like how it doesn't help if, we say something, we know people aren't going to listen. So that goes into public health communications. It gets into, again, how do we change our behavior to better see those outcomes, make sure people are healthy and happy. Another example of this is the stringency index, where basically we really started to see as we start to map the stringency, which is kind of a mathematical view of like how strict are society's rules around movement, around congregating, around other things like that, which businesses are open. And then we map that to the mobility. And again, we saw reduced compliance. Less people were actually paying attention to the rules kind of as we moved through the pandemic. We also had reports kind of showcasing, okay, like these are movements between different centers and things. Those came from Blue Doc. So we don't have those as part of the presentation, but effectively you could imagine like a little bit of a heat map, like this many people, were highly mobile in this area as red. In this area, fewer people were mobile, it's more green. And then that kind of mapped across, like where are things peaking in terms of COVID? So strengths to it. So again, really interesting data, near real time. So it was coming in very, very quickly. Like basically we had weekly updates on this, so we understood what was happening. It was pretty cost effective for us to do it during the pandemic, and it gave us a source of data that wasn't coming from anywhere else. Like we didn't have any other way to understand what was happening in terms of human mobility there. So this was okay, like we should be able to do something really important with this. The limitations, again, perceived risk, like, okay, well, do you really need to do this? What are people going to think? What are people going to say? Again, media articles, which then created a public inquiry into our use of that data, right? Which was, and we started in that on the back foot, even though, again, like you've seen the data, like there was no personal information, but the idea that the government, and someone said it, other people started reporting that someone said it. So it ended up spreading into we needed to go back from, no, we're not doing this, which is always really hard, especially when you're the government and you communicate, sometimes not as in normal human language as one would like. Again, massive limitations in the data. So we weren't able to do the work in the time we had to map it to socioeconomic data. So we didn't look at what's happening within this kind of municipal health zone, right? Is this a high socioeconomic kind of group here? Is this lower? Disaggregated data wasn't part of it. So we had a bunch of other limitations. And again, lack of representation across the population. So what ended up happening? So there was the review by the Office of the Privacy Commissioner. There was the inquiry and cabinet committee appearances around this. We were challenged and we received challenges. So first of all, we came out like the agency had not done anything wrong in terms of this. It had used data ethically. It had used it for the public good. There was no personal information. However, there's still a bunch of issues around this, right? And the main issue being public trust, I would say. Lack of literacy, lack of kind of proactive transparency about what we were doing and how we were doing it. One of the major things that came out of that was the idea of informed consent, right? So I said before, both of the data sources had ways for people to opt out. Were those transparent? No, frankly, they just were not, right? Like one, again, for every app, for everyone playing Candy Crush, by the way, did you know your data was going to be sold by this company to another company who would then sell it to another company who would then sell it to the government of Canada to understand like the movement of populations during a pandemic? Like, no. And for TELUS, TELUS has, again, Data for Good, internationally recognized service. They have got a website where you can go in and you can just kind of enter your phone number in there, and it will remove all of your cell data from the Data for Good program, which they then sell on to other groups, not just the Public Health Agency. How many people know about that page? How easy is it for people to find? Do people actually understand where their data may be used? It's for good, great, but what does this actually mean? So this was a really big piece. Coming out of it, I'd say the main things that kind of I learned and we learned is that you need trust before you need to build trust before you need it, right? You need to build trust before a crisis. You can't go in and do things in the normal way government does things, which is just kind of, oh, we're just going to do stuff like kind of behind the scenes. It's part of our program. It's part of our mandate. So of course it's going to be fine. And then when something big does come up, say, oh, by the way, you should trust us, even though we've never told you what we're doing, right? And we've never kind of put the effort and energy into being open, like open data, open algorithms around this. If we had worked and engaged with privacy pundits before the issue and before the article was posted, it would have been a lot easier. People would have said, no, like we know these people. We know what they're doing and we understand how they're doing because look, there's the data, there's the algorithm they use to aggregate it. There's no personal information here. So like, you're not talking about anything real. Let's move on to the next thing. But we didn't have all that in place, right? So that's an important piece. So one of the things for us is we have a new kind of data transparency portal to the Public Health Agency that says, hey, this is the data we have. This is how we're using it. This is how we're protecting it. This is how we care and how we're demonstrating that we care about privacy. The plans are to go even further there. Again, open data, open algorithms. You want to double check how we aggregate data. Here you go. Here's kind of a sample of the raw data. Here's what we got out at the end. Like, how can we do better? So kind of really kind of living into that, leaning into that space. Another piece would be like, I showed a couple of things about the value that we saw. The challenge was we didn't have the skill set to really understand and analyze mobility data and a strong platform for global like informatics services, GIS data, that would have allowed us to do so much more with this. There are other places internationally that have done some really, really important stuff using mobility data. Around kind of migration of people during crises, wildfires, climate change, et cetera. So we didn't have that bench strength when we started. So we were building towards that when like the public discussion around mobility data came up. And after that point, we were like, okay, well, should we be putting time and effort into this right now? Or are there other things we should be concentrating on? So all of that to say that I believe that there's a lot of value in mobility data if it's done ethically, if it's done properly, and if we can communicate and help to build data literacy amongst people across Canada. And we can really figure out a way to really get at the informed consent in a human language way that kind of pulls things together across different, not even just governments, but across private organizations that are gathering, reselling, and using data for a variety of purposes. So I'll end it there. Thanks so much, and really looking forward to the discussion.
All right, so thanks so much to the organizers for organizing this event. I'm going to be talking on behalf of a researcher, and so these are my experiences and perspectives. So when I was asked to prepare this presentation, I asked myself the question, how did I even get started using mobility data in my research? And really, this is the only math equation you'll see today, but it took a pandemic that gave us access to a lot of free data, a really interesting research question, and a smart summer student that really kicked us off. So I think everybody's heard the term that cash is king. Well, for quantitative researchers like myself or an epidemiologist, data is definitely king. And so now we have the vast majority of us are keeping this tracking system, which is collecting all of this interesting information. So as soon as you turn on your phone starts to send pings to the nearest cell towers. So that's how they calculate how close you are to these cell towers. They can identify where you are, or with Wi-Fi, they know your exact location. So once this data is collected, it's sold to a third party, as Chris had mentioned, and then it's anonymized, and then it's aggregated. So this aggregation can happen at a city level, a county, at a state or a province. It could be aggregated to a point of interest, so specific building, or different modes of transportation. So this on let me see if I can use no, it does not work. So over here, this is an example of the sort of data that you have. This is one little building, and it identifies that there are 10 GPS pings between 12 and 12:30. And that's the sort of data that we collect and we analyze. So how did we use this data for our public health research? The premise here was that mobility could be used as a proxy for contact rate, meaning the more you move, the greater the likelihood is that you're going to be exposed to more people, which means that you'll be exposed to SARS-CoV-2 infections when we were doing this work. So the decrease in mobility was associated with fewer COVID-19 cases and deaths in populations that were able to adhere to stay-at-home policies. So this was evident very early on in the pandemic, and it demonstrated the potential of using this type of data as a public health tool. So what we were interested in was, in the absence of these social distancing policies, can you still use mobility data to track COVID-19 infections? So as Chris had mentioned, there are different metrics or different definitions of what mobility data is. And what most people were using was the percentage of time that you're not at home. So this is one of the definitions. But we sort of hypothesized that in the absence of these social distancing interventions, that you would need a more robust definition of mobility. So we took 6 metrics and we combined it into one and created a new index for mobility. At the time, I was a postdoc at the Washington University in St. Louis, and this is why this data is in the US. But this animation shows substantial differences in mobility based on counties in these 4 states. So blue indicates that there's less mobility with our new index, and then red indicates that there's more mobility. So number 1, you see that there's variation between all these different counties. The number 2 that was very reassuring for us was that there's more mobility on weekends. And so that validated that our mobility index was at least working in some regards. So what we showed was that our index was a better predictor of COVID-19 infections compared to just using devices left at home. So this you can see here, that as you increase mobility, that there's an increase in COVID-19 cases based on those different counties. And it's compared to what people were using before, which was that single index. So that was what sort of the findings of our research were. But what have other researchers used aggregated mobility data for? So this is an example of researchers in Ontario. They evaluated the impact of public health policies restricting staff mobility between nursing homes. So each of these dots are the 643 nursing homes in Ontario. The red indicates there was a COVID-19 outbreak, and the gray indicates that there's no. And then these lines here show movement between all of the nursing homes. And then the first blob of dots is before they put in restrictions, and then the second is after they put in the restrictions. So here they were able to show that after they put in these restrictions, there was a 70% drop in the number of connections between the nursing homes. And in both periods, mobility between these nursing homes was higher in higher communities, those with higher beds, and those with who are part of large chains. So this is an example of evaluating if a policy actually works or not. This is an interesting study where they evaluated if you could use where people are going in terms of food outlets, and if that could be a meaningful indicator for fast food intake and diet-related diseases. So this is actually research that was done from a public health unit in Los Angeles. And what they're doing is they're calculating how many times in a day do people visit fast food outlets. where they're coming from, and how many visits do you sort of you're making to these fast food outlets. And what they found was that using mobility data was actually more accurate than asking people what they're actually doing, which we know, right? People usually lie about these sort of things, but they were able to quantify this. So this is like really interesting from a public health point of view, that it's not necessarily just infectious diseases, but sort of human behaviors of where people are going. This is another very interesting example of they're looking at how when you have, so for this example, they had Syrian refugees. They've tracked 3.5 million cell phones into Turkey, and they did some modeling studies to see how you could disperse population so that there wouldn't be a measles outbreak in this. And so they could actually quantify exactly how many people would you be able to sort of have in a certain community where you could still consistently obtain herd immunity. So this is another type of example. So just for the interest of time, I'll skip this last example. But to tell you that how mobility can be used in terms of public health research, it's quantifying population level movement. It's a proxy for human interactions. It describes where people are going and how long they're staying. In terms of a researcher's challenges, number one would be the expertise to manage and effectively analyze this data. I can't stress this enough, what kind of a challenge this is. We just don't have the expertise necessary from an epidemiologist point of view. So if you go to the computer science world, they definitely have the expertise of working with big data, but they don't necessarily have the context. So it just shows how we have to have sort of a multidisciplinary approach to being able to use this data. Chris already went over some of the biases in terms of the representation of this data. Data sparsity in Canada is a real issue. So when I started working with this data, it was in the US. There was a lot of data then. And then when I moved the research to Canada, it became a bit more sparse and I wasn't able to go as granular as I would have wanted to. Working with commercial companies is a departure for academics. So I started working with SafeGraph, and then they sold it off to another company. And every time it got sold to another company, they changed the data format. And anyone who's analyzed data knows once you've changed the data format, you're starting right from scratch. So that was definitely, that's an issue. Another thing is this data was free during the pandemic to researchers. And then as soon as vaccinations came out, they cut the cord on the free data and we had to start paying for this data, which is not huge amounts of money compared to the amounts that we pay for other types of data, but it's still a barrier. And then having to explain to research ethics boards what this data, who's consented to this data, was a 6-month challenge for me at Queen's. So this is something that definitely moving forward, we'll have to be discussing more. And I think Martin's going to be talking a little bit more about this. So here's the takeaway. There are billions of GPS pings. You can think of it as like a big pile of Legos. By themselves, useless information. Mobility data just sorts those different colors together. The data we get is aggregated. So it's already sort of been locked in to the different definitions. And then you see all these beautiful visualizations of where people are going and how they're dropping in mobility. But what I want to make sure that you understand is meaningful research requires not only just this data, but also the context and the expertise to actually tell a compelling story that's useful for public health research. So these are just acknowledgements. The analytical team that I've been working with for the last 4 years, we're doing a large scoping review of 150 articles that have been using this type of data, and to the Café Scientifique team for organizing it. Thanks.
Hi, everybody. Thank you. Thank you so much to Angel and Mir for your organizational work, for putting this together. Bravo. And it's a real honor to be on this at this event and in this discussion with my colleagues, Sahar and Chris and Sam. Looking forward to the discussion with everybody today. So what I'm going to try and do is cover these three, let's just see, these 3 points. These 3 points are my key takeaway messages, if you like, for today's discussion. Our everyday use of smartphones generates an enormous amount of valuable, very valuable data. Smartphone generated data could be, as we've seen and have been, used for public health purposes. And I guess I just want to also just emphasize like the amazing innovative work as we started to see in Sahar's slides about the amazing innovative work that goes into taking these data that are owned, managed by private sector organizations and making them useful for public health. So I think that's something to really emphasize here. There's a lot of awesome stuff going on. And I think my role in today's discussion, though, is to also just adopt a kind of more of a critically reflective stance to help facilitate our discussion today about this and help us reflect on some of the wider social and cultural conditions of the use of these data so that we can ensure that this work is being done in the most ethical, best, most just way possible. So as we've seen, smartphones have been, I came in from Montreal today. I used Google Maps all the way to get here. Very kind of important app in my life. I use it quite a lot because I have a terrible sense of direction. So, but that helps to generate a profile of my movement, for example. There are lots of different ways that smartphones have to produce and share personally identifiable data, and we've seen some of this today: device level data, application level data, location data, lots of other kinds of data as well. So these data are very valuable. As Chris mentioned, a game maker like King, who makes Candy Crush. Oh, I'm sorry, I just realized I'm out of the camera. A game maker like King, who is the publisher of Candy Crush, has a whole business model sort of at the back of that game that involves data collection and sale of that data to third parties. So we've talked about that already. Now, these data are ostensibly governed by terms of service agreements, privacy policies, and so on. And I've just put an example up here on the screen. This is from the TELUS privacy suite of policies. It's very small. You're not meant to be able to read it here on the screen. And in some ways, that's kind of a reflection of the reality of these agreements, right? They're not really like, nobody sort of sits down and spends the day reading them. Very few people read these agreements, and this is shown in research recently. This is a quotation from the Pew Research Center, who has done for a number of years studies on people's use of the internet and how much or little they engage with things like privacy policies and terms of service. They say in their 2023 report on this that the public increasingly says that they don't understand what companies are doing with their data. So, I mean, this is a kind of an issue that we, I think, have to wrestle with when we want to think about using data from the private sector under these kinds of conditions for public good. This is part of, let's say, a wider culture of surveillance, which I've got a picture up here of David Lyon's book, Culture of Surveillance. Dr. Lyon is actually in the audience. Thank you for coming here today. Not to put you on the spot, David, but this situation is part of a wider culture of surveillance, which I think we need to reckon with as we think about how to use smartphone data for public health. There are lots of, Sahar highlighted some great examples of mobility data used for public health research. I just have a couple more here on the slide. Lots of really important, innovative work that I think we want to, think about how to nourish for the benefit of the public good. At the same time, there is an emergent debate, and this is part of the debate. So I'm, putting all of the audience here on the spot too. I want to hear what you think in this debate. There's an emergent public debate about how to do this. Chris talked about their experiences during the pandemic. There's a great short report just describing, these this initiative in some detail, which is very much worth reading. And, then a sort of set of questions that were raised around, how to improve this undertaking. And I think that, coming out of this, there are a whole bunch of questions, but I'm going to try and highlight 3 questions for us to reflect on today. So Chris talked about consent, Sahar talked about consent. What does consent mean? What sort of consent mechanism should govern, I want to say, private sector use of smartphone generated data? First of all, I think that's a kind of an interesting question to ask. I mean, can agencies like the Public Health Agency of Canada exert any pressure on companies that maybe don't have the best data practices to become better? I don't know. It's an interesting question to think about. So this image on the screen here is a picture of the TELUS Data for Good, opt-out consent mechanism that Chris was talking about. And I just want to underscore that it's an opt-out mechanism. So that means that you have to know about it, right? You have to know where to go to opt out. And so that's an interesting kind of set of assumptions, let's put it like that, right? Who knows about how to opt out? Who knows how to do it? Do we educate the public? Do companies educate the public sufficiently to be able to do it? So, there's a set of questions here for the private sector, but then I think also, as someone like me, I work in a public sector university, largely public university. What kinds of consent mechanisms should govern, my relationship to this smartphone generated data? And then how do we think about the interface between public and private sector organizations as we're trying to negotiate this? Here's another question. How do we understand the relationship between personally identifiable data and anonymous data? This is a complicated, complex question. I just wanted to highlight this lovely article by LaTanya Sweeney entitled "Only You, Your Doctor, and Many Others May Know," because it kind of shows how she was able to take data that were ostensibly de-identified and then match them with other data to re-identify the subject of the data. So I know that people who work on de-identification are taking these questions super, super seriously, and they are, there are evolving mechanisms and practices for de-identification and anonymization. I think, what Chris was talking about is, I think a de-identified data set that were further kind of anonymized in the sense that, the data were aggregated before being shared with the Public Health Agency of Canada. But it's an interesting set of questions maybe to wrestle with a little bit. How do we think about the relationship between personally identifiable data and anonymous data? And I guess, I also want to argue for not fully disconnecting the notion of personally identifiable data from anonymous data. The data, at the end of the day, did come from somewhere, right? So we also need to kind of like think about how we organize to recognize that. That's a bit of an abstract kind of idea, but I just want to locate that for you within a broader framework of economic justice, for example, right? So these companies make a lot of money, and they're making more money off of this data. What's the political economy of that? How do we think about that as researchers and public health workers? Lastly, I think that there is a need to build trust around these initiatives and what forms of community engagement are necessary to build trust. So I highlighted, I can just pop back here. This report, for example, on the right side of the slide made several recommendations for the Public Health Agency of Canada and others to think about in the future, should mobility data be used again. And one of these recommendations was to consult, consult broadly. Recommendation 22 says that there should be consultation with stakeholders and community groups that may be disproportionately affected by such initiatives. And the government, this quotation at the bottom is sort of the Government of Canada's response saying, yes, we are going to consult. A set of questions we could get into today is, what does that look like? This is a great example of community engagement potentially, but, how could we amplify this, build on it, and, mobilize it more broadly? So I think I'll just stop there. I just want to thank everybody for your attention today and looking forward to the conversation and the discussion. I've raced through things. Hopefully I've highlighted enough to get some of the discussion going.
I'll pass the microphone back to Angel to close things off for us. Thanks.
For the interest of time, we're going to officially stop accepting questions right now, but you're more than welcome to stay. We have this venue booked until 3, so if you want to stay and chat with the panelists in person, and as well, we're going to keep the Zoom on. So if you want to keep popping questions on Zoom, that's okay as well. Thank you so much for everyone for coming, and I just want to acknowledge that this entire event was funded by CIHR, and this was just a completely novel topic that we threw in the grant for, and we actually got it because it's so interesting for researchers, for the public alike, and we're really glad that we were able to have this conversation today. So thank you so much. Thank you to our panelists who traveled far and wide to come here today to Kingston. Thank you.